office that you want to start working, meaning hospital or doctor's offices, in general, they have their own policies. So probably something that you are doing in this clinic, you might not be allowed to do in the second one. Maybe things that you were doing here that you weren't allowed to do it, the other one, according to your scope of duty, might allow you to do that. So always move from job to job, because sometimes we change. See, since I start working, well, my age is double the some of you. So when you go there, you learn the policies. There is a book there is the policy book, but nobody sees, nobody reads it, right? Check the other people who works over there. Ask questions, always. See, the things that I do when I start a new job is to check where the things are, the things that I'm going to need to work. Because the worst thing that can happen is that you have a patient right there waiting for something and you don't know where the needles are, you don't know where the tubes are, you see a bunch of things on top of the counter, but some of the things that are there are not the ones that you need. What is the urinary cups? What are those things? Where's the little machine that you do the hemoglobin? And you have to do it. You know how to do finger stick, but you don't know where the lancets are. So always get familiar with the room. We always have time, plenty of time. In this office, they keep the things on the top shelves, on the top cabinets. The other one might be on the bottom. The other one might have a storage room. So learn the things, because not every single office design is the same. But we have the knowledge and we go there and start looking for things. Think about when you go to your friend's house. They put certain things inside the refrigerator. One way is the way that they want it. And you look for something, let's say milk or water, and says, oh, my water in my refrigerator, I put it in this way. So as soon as you open the refrigerator, you're going to look at that side, right? That way. But it turns out that it's not there. So always get familiar with your environment so you don't feel lost. Always ask. There is nothing wrong with asking, because it's better to ask than doing the things wrongly, right? And then trying to correct them. So that's better. So the first thing that we do, remember, we receive the order from our doctor. He says, okay, Alberto, do me a favor, do an EKG. So immediately I receive the order, I'm going to the patient, or the patient comes to me with the order. Just think about when you go to the doctor's office. If the doctor orders blood, usually, or they give to the technician the order, or they give it to the patient, and the patient comes with the order. It says, hi, the doctor gave me this, and pass it to you. As soon as you see it, you immediately recognize that paper, right? You said, oh, want some blood? Good. Why? Because in that little office, in the doctor's office, is the place when you do blood, you do EKGs, you do a lot of things. So it's not like you're going to have a separate room for everything. So if they come here, then they're going to do this. If they come there, no. Over there is mostly a multitasking room. Everything you need, patient comes to you. So you look at the order, it says, okay, oh, sure, we're going to do an electrocardiogram. The patients always turn their heads saying, okay, what is that? Say simple. Don't say, oh, I'm going to do an EKG. We all do that. I'm going to do an EKG. I'm going to do an electrocardiogram. Then the patient look at you like, hey, tell me more because I don't know what you're talking about. No, the doctor ordered a test. So I'm going to put some stickers on your chest and your body, because they're going to check how your heart is functioning. Now, some of the patients are going to say, no, I'm fine. I'm nothing wrong with my heart. I said, this is just a routine procedure from the doctor, okay? Always put the doctor up front. Why? Because if you say, oh, I'm going to do this, they think that it's you, the one who wants to do something. No, it's the doctor. And usually when you hear the word that the doctor ordered that, kind of they don't challenge you. I know this. But if the patient says, no, I don't want to do it, They did it last time. I have no problems. I have no time right now. Can we do it some other time? Not a problem. Don't argue with your patients, please. Remember that the patient has the right to refuse treatment. That's one of the rights of the Bill of Rights of the patients. So don't argue. What you have to do is try to convince the patient. Say, hi, by the way, Mr. Rodriguez, it's very important for you to get that test. Remember, that's how the doctor is going to know what really is going on with your heart. No, but I'm fine. Just to follow up, just to make sure that later on you don't have something and we don't cut it on time. So make sure that you explain them. Oh no, still, I don't want to do it. No problem. But tell the patient, like, excuse yourself from the patient, tell the doctor. Hi, Dr. Hoyer. Yes. Well, I have Mr. and Mrs. Smith that you ordered to do an electrocardiogram, but he or she is refusing. They said that they don't want to do it now. They give some arguments about it, but in a nice way. Don't go there with an attitude. Oh, I have the patient over there, because immediately that shows that you don't know how to conduct yourself. Then the doctor thinks that you gave the patient an attitude, and that's the reason why the patient don't want to do it. No, in a nice way. Listen, if the patient don't want to do something, shouldn't you be happy? Less work to do. Take it to your advantage. I have 10 patients. 5 I have to draw blood. 2 I have to do EKGs. And one of them says, no, it's less work that I have. Sure, Mr. and Mrs. Smith, no problem. Let's inform the doctor and, schedule your EKG or your blood drawn for the next time. So that's what we do. And they're gonna like you if you're not forcing anything. And we shouldn't be forcing anything. That's for their own good. If they don't want it, goodbye. But you inform your doctor because your doctor is expecting that you completed the task and I want the results, right? But if the patient leaves and you don't tell anything to the doctor, what is the doctor going to think? Oh, I'm waiting for the results for the EKG. What is it? And I go up to you and say, hey, what's going on, Alberto, with the EKG that I ordered from Mr. and Mrs. Smith? And you say, oh, no, the patient left. Oh, so the patient left and you just didn't say anything. No, we have to inform the patient and we have to record that information on the patient's medical record. Because if something happens to the patient, let's say that the patient walk outside, right, and have a heart attack, or go home and something happened and have an emergency, what do you think this patient is going to do? It's going to sue the doctor. It's going to say, no, I just wasn't my doctor. They said that I was okay. They're always going to lie. They're always going to say whatever is convenient for them. We are humans, right? We don't blame ourselves. I'm not going to go to the doctor, to the medicine, and say, wow, you never have these symptoms? When was the last time that you were in your doctor? Oh, I was just yesterday in the doctor. They did an EKG. No, they didn't do anything, as usual. But whenever you order something, they're going to complain. Remember, this comes back to us. But if you documented that the patient was there, an EKG was ordered, but the patient refused to do it, who is responsible for that? The patient, not you, not the doctor, not the office. That's why we have to have everything documented. No documentation, it is he said, she said. It is my word against you. And usually these attorneys are gonna go for who? The patient. Because they said, hey, I'm doing the work for you, I'm working for you. Because if you win the case, I make money. So let's attack these doctors, let's attack this hospital. But we are in the middle of the trouble because we have to go as a witness over there and testify. So we don't want to avoid all these hassles that these litigation states. So we do the things right. So we check the information from the patient. We're going to tell the patient what we're going to do always. Now, because these are questions for the exam, the national certification. Why do we tell the patient that we are going to do this or that procedure? Because we are receiving from our patient that they are perceiving, oh, we asking permission, remember. So we asking for consent. Now the patient is gonna say, yeah, it's okay. Or simply the patient just follow instructions. Please take a seat. Please remove your clothes. You give a gown. We're gonna go through all that. Remember that there are different types of consent. We have implied and we have express, or which is written and spoken. So when you give a command to a patient and says, listen, Mr. Smith, the doctor ordered an electrocardiogram. And the patient said, oh, no, I'm sorry, but I'm not gonna do it. Or it says, yeah, that's okay, no problem. That is not imply. Implies when the patient does not talk, does not write anything. Just make kind of facial expressions, so they just nod their heads, because these come on your exam. Imply and express consent. Implies when the patient, I'm gonna be drawing your blood, Mr. Smith, and they go like, yes, perfect, that exactly like this. They raise their arms and said, without saying anything, or you just nod, or they just go and say, please have a seat right there, and then I'm gonna draw your blood, and then just sit there without saying a word. That is imply. You don't need to talk, just the actions of the patient will tell you that. So don't forget about implied consent and express consent. Express is written or spoken. Sometimes, if it is a surgical procedure, we don't do implied consent. We do a express consent because it has to be written. There are a lot of things that goes through this. So it's very important for you. Now, once again, what else we gonna get? So now that we got the permission from the patient, the consent, we're gonna tell the patient, remember, we're gonna give the patient a gown. Always we're gonna give the patient a gown. Whether it's a male or a female, it doesn't matter. Because sometimes we said, oh, the males don't worry about exposing their chest. Well, there are some males that have certain, marks, certain body shapes, and they don't want someone to be looking at them, right? So you just give them a gown. Remember, you're gonna ask the patient to remove their clothes from waist up. Explain them. Otherwise, the patient is gonna remove all their clothes. That is unnecessary. Remember, you are violating the privacy of the patient. And think about this because it happens to some medical assistants and some nurses that have asked to go and do certain procedures to the patient. If they don't tell this, there are lots of people there. Remember, there are people there that has other things in mind. Is that understood? Particular guys. And nowadays, because they want to suit, then they do stupid stuff just to put you on the spot. Is that understood? I have a medical assistant that ran out the little exam room screaming because they asked the patient, okay, take this gown, change and put this gown. When somebody tell me change and put, it's like remove your clothes, right? No, you have to be specific. What is it that they have to remove? Now the guy was completely naked and something else when the person there, the medical assistant that 99% of the cases is a female, they do it on purpose. So for that reason, explain, oh yeah, I'm done this before. No worries, still explain. Just remove waist up. And you will see that you're gonna save a lot of trouble yourself. I'm telling you, people just looking for the moment, the opportunity, and they always do it to the girls most of the time. So avoid those things. And besides that, the time that they're gonna take for removing everything, no, just waist up and that's it. So we're gonna enter there in the machine. It's like a little computer right there, right? So you're gonna enter this information. Full name, patient's first name, last name. Now, remember that in this country we use the first last name. Some people from some countries like me have 3, 4, 5 last names. It's not that has like 10 fathers, no. It's like they use the whole generation last name. So here we don't use that. If my name is Alberto Hoyer, something else, it's Alberto Hoyer, that's it. If you have two names, the first name, the second, you put an initial just to make the difference. That is it. Then you put the day of birth. Then gender. You have to put there if it is a male or if it is a female. Why? Because when we do electrocardiograms, you know, then for females, the electrocardiogram sometimes comes a little slower than males. So for that reason, we need to know who, the age of the patient, how tall is the patient, all the information is here. Patient age, gender, I don't like to say sex because that's kind of sexual, right? So it's better to use the word gender. And usually this machine sets gender. So you place there male, female, or other, because we do have others. So make sure that you do that. If it is written on the medical record, don't assume anything because your patient looks like, is talking like, and then I said, oh no, this is not a male, this is not a female, this is something else. No. If it shows on the medical record there is a male or the ID or it is a female, you just mark that. Is that understood? Also, don't ask the person, so how you are identify, you male or female? Because it's very, very uncomfortable, very sensitive. No, some people is just go there thinking, oh, free of speech. I can ask it, no. This is medicine, and in medical, we are very careful of how we treat it. Remember, that can be discrimination. That can be a lawsuit right there.
But what if you see on the ID that it says male, and then they get offended because you said that it was a male?
No, because you're going to just type it there. You're not going to do anything else. It's going to be on the printout, and the doctor is going to be seeing it. And now, if your identification says male, and you feel like you're not, that's not my problem. You're just gonna put, isn't it?
Yeah.
You're just gonna put what is written on your ID because that's how you want yourself to be identified. Remember, we don't go don't go too much farther on imagination. What would that know? I don't know. I have patients like, I don't know if I can describe the things that I have seen, but still, composure. Remember. Not making faces, not laughing. Patient is watching every movement that you do.
What do you put if they say they them?
Say what?
So what would you
Other.
put if
I
they
think it
say
said other.
put other?
Well, a patient is not gonna say they don't. It's gonna be on the ID. You're not gonna
go by
ask.
what the
Right.
ID,
By the
okay.
Yeah,
by the
it's
medical.
the
See,
ID.
when the doctor give you the order, it says right there, male, female, or other. So you just place that. That's what I'm telling you. Don't ask the patient because you can say male right here, but the patient is dressing like a woman. I said, oh, wait a minute. Are you a male or are you a woman? Okay, now, what is my job? Do an EKG. Follow the rules. That's it. Race. Believe it or not, that goes with, I don't like race either. I like to put ethnicity because that's how it should be. But the EKG don't want to use too much space, so they do race. It's important to know the race of the patient. Why? Because some of the races, some of the ethnicities suffer more of heart conditions than others. Is that understood? So when I see all the characteristics of my patient, immediately, just for the signs and symptoms, is male, is this ethnicity, this patient tends more to have problems, so I'm going to focus more on them. So for that reason, it's here. It is not optional. This is not like your resume or you filling out an application when they say optional, right? Here it's not optional. You have to put that information. Cardiac medications. I mentioned yesterday for the ones that were here, but I'm mentioning it again. Cardiac medication, well, the most important thing is name, last name. Remember, 2 points identification, question for the exam. Anytime that I cover something, I'm gonna tell you what the questions are gonna be. So no surprise for you when you taking that national certification, because when you heard it once and you see it written over there, say, oh wow, wait a minute, I heard this, so this is gotta be. In your exam, they're going to ask you every single time that you go to see the doctor according to the regulations of HIPAA regulations, there are 2-point identifications for the patient. So what is those 2 points identification for the patient?
Right?
Name, full name, remember,
Oh,
name and
that's
last
like
name,
the
plus
address.
birthday. That's it. Those are 2-point identification. And they have come numbers. They said 1, 2, 3, 4, because it's multiple choice. Your exam is multiple choice. Back in the days, it was filling ins. Can you imagine? Who will pass? I will pass.
Not me.
If I read it, I said, that's the one it is. But if I don't see it, oh my goodness, how am I going to retrieve all that information? It's too much. So it's a lot easier. Still, you need to know it to be confident, right? That you know what you're doing. So these medications usually in a doctor's office, we don't place it. Once again, go by the policies of your organization. So whenever they ask you to do an electrocardiogram in the place that you're working or training, whatever it is, you're gonna shadow someone who has done it before. Listen, I know how to do an EKG, but the machines are different. So sometimes, even me, I don't know every single machine. I remember once that I got my son an Apple tablet, right? I don't use Apple tablet. I have my cellular phone that is an Apple, but I like my PCs. So I liked this because I'm very used to them. So every single time that I have a laptop, something has to be that old one, not Apple. Well, I got that one day because I said, wow, this is kind of nice. And besides, I pay for it, right? So I'm going to use it. Oh my goodness, I couldn't find all those things because they are in a different format. So think about that. When you're going to use an EKG machine, get familiar with it before you start using it. Why? Because you need to know how to turn it on, how to place this, how to move this, how to enter the information, and so on and so forth. So get familiar, always with the things, particularly when you're new. After you get to know that, easy. But if you move to another place and it has a different brand EKG machine, again, you have to get familiar with it. Is that understood? There is always something. So follow the policies of your organization. If your doctor says, listen, the person that is in charge there, the office manager usually, or the supervisor nurse is there, said, okay, we're going to do an electrocardiogram. Sure, I need to see what is the machine. Always be smart. Don't pretend like, oh, no, I don't know how, I don't feel comfortable. I just came out from the school, and, those things, it seems like I know, but I don't know. Don't say that, because people are not going to trust you. So then said, okay, can you do an EKG? Oh, sure, definitely. Oh, can you show me at least the machine? Because the machines that we use, I don't know if it is the same brand. I don't know if it is, because it's true. So then I said, I know how to play the electrodes, the cables, enter the information, but I need to know how to, the features of the machine that I'm going to be using. And and then this is what they do. They want to do the things for you so you can see what they do. But if you say, oh, no, go ahead, do it yourself. No, I do something else. They see that you're not willing to do anything or to learn, okay? So always put yourself out there. Yes, I know how to, because you're going to learn with me how to do an EKG. It's not that you are faking it that says, oh yeah, just to get by. No, you're going to do it, but I cannot promise you that the machine that we're going to use here is the same that they use over there. Usually are not. Sometimes they have something that is more modern, maybe not. Because the doctor's offices, they are very cheap. I'm telling you, they are cheap. They have a machine that still, you have to turn it on with a match and something like that. Yeah, light it up. So, it takes long to warm up. They have one channel that was one strip and then you have to chop it up, cut it, and paste it. So, I don't know where you're going to end up working. But assuming that you're going to be working in a place that is up to date with technology, you're just going to get one page. The whole 12 leads EKG are going to be in one page. So hopefully that's the case, right? So once again, if you work in a cardiologist, this is a specialty. Then you have to put medications, you have to put diagnosis, you have all the information is given by your doctor, of course. It's not that you're gonna make it up. Or ask the patient, what medication you taking? No, because we are more concerned about the medications that are used for hypertension, hypotension, heart conditions. Is that understood? It's not Tylenol, it's not the diabetic medication. No, we're gonna know the medications that affects your heart or are used to kind of keep you going because you have chronic heart conditions. Weight and height, very important too. We have to put it there because a person who has certain weight, depends on how tall they are, they tend to have more heart conditions because most of them, they might have diabetes. And diabetes is a factor, that a risk factor for heart conditions and other things. So we have to go by all that. Any special conditions is like, well, they have Alzheimer's. Well, a patient who's Alzheimer's is not like a normal patient. This patient is kind of, you have to move them around or with someone else. Or this patient is an amputee. See, he lacks legs or arms. And what is that important? Because we have to change a little bit the way that we place those electrodes. So all those things start changing a little bit, okay? So all the patient has a pacemaker. Immediately you know it over there. These things, when you read the page that the doctor is saying you, most of the information is there. And once again, ask the person that is working there before what information you need to put on an EKG. Based on my experience as a medical doctor and a medical assistant, most of the time, remember, if you are in a doctor's office, the basics only. No medications, no diagnosis, no symptoms, because this is not like the emergency, right? But if it is an emergency or with the cardiologist, it's a different issue. So that's basically what it is. Any questions? It says right here, billing. I'm going to tell you something. Don't worry about this part. This is none of your business. Not being disrespectful. But billing and coding, that's someone else gonna do it when they fill out the encounter form and then send all these claims to the insurance company, right? So here, I have never, ever entered no information about billing. Actually, it's not even asking you. There is no way that you're gonna put billing when the information is not there. The information might be on the order, but that's nothing to do with me, because what it has to do with you is the the patient's personal information that you're gonna enter there. That is it. Anything else, do not worry. So this part, no. See, patient information. That is what we are concerned about. So right here, enter all the LCD. That's the screen, because it has a little screen. Most of these computers have, and you have a keyboard. Everything is a computer. So you're just gonna enter, and they're gonna ask you each personal information at the time. So you enter this patient's name. So when you open the computer like this, you click on. No, don't worry. On, and then you start entering the information. Start. Then you click it, and then it comes on the screen all the personal information that you have to enter. You the only thing is like filling out an application. Is that understood? Patient information, you start in the name, last name. Some of the computers you put the name and last name in the same spot. Some of them has last name, first name, race, and so on and so forth. So get familiar with this information. You already know it because you have kind of completed certain applications when they ask you all your information. You just fill in the blanks. That's it. Now, the ones that you're going to skip, I'm going to tell you whenever we do it with the machine right here. But I'm telling you right here, most of the basic things are the ones that you have to enter there. Law and ethics, very important, because these are questions for exam. We always have to keep HIPAA, law and ethics, and OSHA. This is not something that you're going to put aside. Now, always, OSHA, I have to wash my hands, I have to wear gloves if I have to wear gloves. So, take care.
Lock the door.
No, leave it like that just in case, yeah, one of my students runs late. All right, see you next time. Thank you. Huh?
Ciao.
Yeah, ciao, bambino.
You said law and ethics and what is the other one, the third one?
OSHA and HIPAA. Remember, OSHA, because you have to be, aware of the risk of getting an infection or passing an infection. So you put gloves if it is needed. Now, question. How many of you have ever received an electrocardiogram? And they have done an electrocardiogram on you. And what is the reason?
No, I don't know the results, but I got it done. I don't know the results though.
No, not the results. What was done for? What was the reason? What you were complaining about it?
Me, heart palpitations.
Okay, palpitations.
Me, asthma.
Because you have asthma and you have shortness of breath mostly. You, just because they want to do it for a normally disease.
I was playing basketball. I ripped my ligament. I got an EKG. I don't know why, but
Well,
that's how it happened.
Yeah, most of the time when you have some type of injuries, they do that.
Okay.
It's part of like the routine test, just to make sure that something is not gonna go wrong with your heart, okay? So, and it's easy. Remember, now non-invasive. Remember these words, non-invasive. What is non-invasive? I don't have to go inside your skin. Nothing. It's from everything is superficial. So it's going to be a lot easier. And that's why you can do it. So, like certain trainings, you don't need a long training. See, to become an EKG technician, you can do it in 50 to 60 hours. That's it. You EKG technician. Because EKG technician is just to perform the EKG, not to interpret it. Remember, you don't have to read the EKG, but you have to know how to do it right, so you can bring the printout to the doctor, and the doctor is going to evaluate that. Is that understood? So, it is part of the medical record. Therefore, information must be accurate. That is law and ethics and HIPAA right there. Not to divulge any of the information from the patient. The patient's information has to be kept confidential, private. If you hear something about the patient telling you something that has this condition, or you see some abnormalities when you're doing the EKG, you should not be telling the patient anything or making comments with anyone else. This is not our job. So that's basically what it is. Always do the things. Whenever they do an EKG on you, they draw blood or they do a test, what is it that you need to know immediately? Results, right? So most of us, whenever they do something, okay, how was it? How was my EKG? Am I fine? Am I good? Is my heart functioning okay? Then what is the answer? What is the answer to the patient? If I tell you, you're doing an EKG to me, and then I ask you, okay, could you do me a favor, Tatiana, right?
Mm-hmm.
What is the results? Am I going to die from heart attack?
No, I would tell you that you need to talk to the doctor. Would talk to
Thank you very
the
much.
results.
So that's exactly what you have to do. Exactly. You're going to be seeing the doctor soon, okay? I'm going to bring this to the doctor is going to be talking to you. That's it. Oh, you don't know? Some patients, they challenge you. So you're doing something and you don't know the results, but you're looking at it. I said, Mrs. Smith, I'll be right back, okay? Smiling, don't take it personal. They're not offending you. It's just that they want to know right away what's going on. It's like when you go to the doctor. Do you want to be waiting in the waiting area? No. As soon as you step right there in the counter, you want someone to take care of you and immediately put you to see the doctor, right? But it doesn't happen. So again, don't take it personal. Just follow the rules. Mr. and Mrs. Smith, the doctor is gonna give you the results, okay? They're gonna talk to you. Oh, but you don't know. Oh, don't say, oh, well, no, just not. They're gonna talk to you, okay? Thank you so much for coming. Well, I'm going to the doctor, please. You can put your clothes back on and then you step out in a nice way. I'm not gonna get upset because they're not gonna get an answer anyways. So after that, you said, okay, Smith, ready? Doctor wants to see you. They're gonna discuss the results with you. They're gonna be so happy now. So don't get into any of these altercations with them. You guys know a lot of stuff. What did you guys learn? Seems like I'm gonna kind of cut down on all the information because it seems like you guys know this stuff. Another thing that is here. See, sometimes we use a machine and you are not the only tech. You are not the only medical assistant. You're not the only one who's using it. We have to replace the paper. The paper is not there forever. So it has a roll of paper and you need to know when this paper is going to end. So whenever you are printing something like 3-4 printouts, 3 or 4 pages before the paper is kind of gone, you're gonna see this line on the first, like the last 4 or 5 pages. When the paper is running out, I have, let's say, 4 pages left. Let's put it that way. So 4 pages before the paper is over, then you're gonna see this line right there at the end of the paper that you remove. Because remember, this is like a roll, right? Every single time that you do an EKG, you have to tear it off. So that part, you're gonna see that line. I'm gonna show it to you when we get to the practicals. And then you're gonna say, oh, that means that this paper is going to be over soon. So then you need to know what is the other roll of paper that you're gonna be replacing this. Is that understood? Always. It's like when how many of you drive a car? Oh, you think that you drive, because I think that I drive. How many of you drive a car, whether without a license or without it? Okay, so the first thing that you do when you enter your car, I don't know anything about mechanics, but I check if I have gas, right? Yeah. So this is exactly what you do here. Check if you have enough gas to go to the next gas station. Not that I'm going from Manhattan to Long Island and I got stuck, without gas somewhere. So that's basically, so here we have to see that everything that we're using, we're not gonna be in the middle of patient is right there, waiting for us to print it out, but there is no paper. That is embarrassing and make you look bad in front of the patient. Now you're running around trying to look for the roll of paper and you don't know what it is because you didn't look for it before. So be prepared. This is like when you're drawing blood. Always bring more than the tubes that you need to draw blood. Why? Because one of those tubes ran out of vacuum, or it is defected, or it fell down, or something else, or it didn't work. Then you have like kind of spare tubes. Well, we have to have this close to us. So whenever we need it, we check it out. Okay? So this is time to replace it. Always, when we're gonna operate any type of devices, it's not my coworker who I'm gonna be trusting how this machine works or operates. So you have to use always the manual of the device, because these are questions for the exam. Remember, it says right here, read the operator's manuals before replacing paper. Now for anything, so they can give you a question more likely like this. If you are having problems with your EKG machine, you don't know how to operate, you don't know how to function, who do you ask? And then what will be the answer? The operator's manual. Oh, the machine manual, every single machine, and it's there. Usually it's handy. You're supposed to have it somewhere so you can read how this machine works. Because if you don't get familiar with that, then it's going to be a problem. Anytime that we buy a device, it comes with a little insert, right? Information, and sometimes with the pictures, with diagrams. This is the button to turn it on, turn it off, move here, move there. This arrow goes up, this arrow goes to the left, to the right. So learn how this actually works. But for the purpose of the exam, I just know that when you need some information, go to that manufacturer's manual, because that's what you need. When we get to go to the practical, I'm going to show you how to open the machine, how to turn it on, how to apply all those, and how to change the paper, because the paper has a side. See, this paper, the EKG paper, is a waxy paper. And all these lines and all these diagrams that we see there, all these waves, it is not a pen that is doing that. No, it's a little needle that is there because this paper is a waxy one. When it's heated with the machine, as soon as you pass this needle, it's marking just that. So if you go there and scratch it, you're gonna make marks, you're gonna damage it. So for that reason, this paper should not be stored where?
In one facility.
Correct. See, you took this class before, right? Yeah, I know you took some other stuff. But once again, if it is waxy, and if heat is the one that triggers to damage, well, you should not keep it, store it in a warm place, because it's waxy, so it's gonna melt, right? So it's gonna damage the image or the recordings that are there. Communication, communication, communication. There's nothing better than communicating effectively with your patients. So identify your patient. Remember, we're going to repeat this over and over because it's important. If you get the electrocardiogram from the wrong patient, can you imagine putting somebody else's name with somebody else's results?
Now they gotta rush you to heart surgery.
Can you imagine how many times this have happened, that the patient goes to the surgical procedure to remove an organ, to operate on this particular part of the body, and they do it to the wrong patient. They remove the wrong organ. They amputate the wrong limb. So many things have happened because we don't get the appropriate personal information. We have to verify. So when we're going to do a surgical procedure, it's not that we're going to just look at the paper and say, oh, this is the patient. No, we're not going to verify like 10 times before this patient gets the surgery. And not identified by the same person. Because if I identify, why should I go again? No, now the nurse is going to do it. Now the anesthesiologist is going to do it. Now the instrumentist is going to do it. And so on and so forth, to make sure that what part of the body, what organ is going to be operated on, and so on and so forth. This is not just, and even though after all this processing, people make mistakes because we take for granted. Oh, we know it. Oh, just, if the doctor did it, I'm the assistant. What should I go there and, challenge the doctor? So no, nowadays, you have to do it more than once. So check the full main identification number. Remember, identification numbers are very commonly used instead of the patient's name because we use the medical record number, remember. Or if the patient is hospitalized, the patient is being given an ID of hospitalization and is found in the, on the wrist, an ID, or the ankles if it is minor. So we always gonna have a way of identifying the patient. What if you didn't find the identification of the patient? What are you gonna do? Or the patient cannot identify themselves. because it's a child and it's a mentally disabled person. What are you gonna do? You're there to do an electrocardiogram, but you cannot communicate with the patient. The patient don't have an ID. They don't have a bracelet or anything else. What are you gonna do? You do it. You're gonna do the EKG based on the room number, based on the bed number. No, never do anything without the proper identification of the patient. So you're gonna go to the nursing station, and that nurse is in charge of all these patients, and you're gonna go there and you're gonna tell them, "Hi, nurse, I'm the EKG technician. The doctor ordered an electrocardiogram on Mr. or Mrs. Smith. I went over there. There are 2 beds, only 1 patient over there, but the patient don't have identification. What is it that the nurse is gonna go and do? The nurse is gonna go check. They know what patients are, and then come and generate a temporary ID. Now that the patient has an ID, now you can perform whatever you've been asked to do. Is that understood? Because these are not only important to make sure that you are doing the procedure on the correct patient, but these are questions for your exam. If the patient, you cannot identify the patient. If the patient is admitted in a hospital, you go to this nurse station, and the nurse has to come, verify who patient is it, and then you do that. What if you enter the room? Remember, never do a procedure on a patient based on the room of the number, or the room number or the bed number. Patients sometimes they lay down on the wrong bed. If there are 2 beds, sometimes they're sick. Remember, so there are 2 beds right here. I went to the bathroom. The other patient was taken to the X-rays, to physical therapy, for surgery or whatever else. The other one don't recognize the bed, and they just lay down on the bed that is not theirs. So you don't use that for. So what if you enter the room and you're gonna draw blood or you're gonna do an EKG, and it turns out that the patient that is there don't have an identification with them? Remember, patients that are hospitalized, you go by the bracelet. Nothing else. You don't ask the name. "Hi, what is your name, mister?" They are under all these medications. They probably have mental disabilities. Who knows? So for that reason, you don't ask names. You ask name when they come to the clinic. In an outpatient setting, you ask name, birthday. For the ones that are hospitalized, you don't do that. Read the questions. It says, you enter an inpatient room. Inpatient means the patient is hospitalized. And you're gonna do blood on this patient. You're gonna do an EKG. But the patient doesn't have an identification, doesn't have a bracelet. What are you gonna do? Go to the nurse station, get a temporary ID, period. Now you enter the room, the patient is laying down on the bed, and right beside the bed is the bracelet. Because the bracelet, it was turned out and it was broken and fell off from his or her wrist. What are you gonna do? You're gonna ask, oh, what is your identification? What is your bracelet? They tell you, oh, here it is, but it's not on the wrist. What are you gonna do?
Take it to the nurse station.
Again, that's probably somebody else's. You know what happened to one of my colleagues, unfortunately? Went to do a procedure on a patient. It turns out that this was not the patient. This was the companion. The companion was waiting because the patient was taken to the X-rays. But the companion was as old as the person who was admitted. And then the companion fell asleep. This person came over, the person said, hi, are you Miss Sis? Yeah, say the patient. Patient was awakened, and you don't know what it is, you were kind of lost. And because you were laying on that bed, it drew blood from the patient, and then sent that blood, and imagine the trouble from then on. Now remember, these blood results are going to be documented on somebody else's that is not theirs. And you cannot remove them. You cannot delete them. You cannot tear off the paper and rewrite it. You cannot do that. That's illegal. So now you have to put all these situations, writing notes, additional notes, legal issues. No, make sure. What if that was something else, like a medication, and you put this patient a medication, and that medication killed this person or give an allergic reaction? Big problem, right? So whenever you don't see the ID on this person, nurse station. Remember, you gotta go to the nurse station, inform them that you're gonna do a procedure, but the patient does not have an identification. The nurse is gonna go there, get an identification. Now you're gonna have a temporary ID, the bracelet. Now you're gonna do it. If it's something she does or he does wrong, the nurse identifying, that's none of your business because you did your part. The rest goes beyond what you can do. So that's basically what it is. One of the things that are very important, remember, is introducing yourself. How many times have you gone to a place and this person asks you, okay, the doctor asked you to draw blood, and then you see there, they never tell you your name. They don't even have a name badge with them. And if they have it upside down. No, it is illegal. You should not misrepresent yourself either. I'm a medical assistant. If they say, oh, are you a nurse? No, you're not a nurse. You do not misrepresent yourself. Say it. My name is Alberto. I'm the medical assistant. If I'm not medical assistant, I'm the phlebotomist. I'm the EKG technician. Say who you are. That's it. Don't create any troubles. Because patients do not know. They see you dressing with these nice scrubs. The first thing that they think, oh, you're a nurse. Everybody's a nurse for them. So don't misrepresent yourself because these have consequences. Yeah, it's nice that somebody call you a nurse and I tell them, oh, thank you for the upgrade, but I'm not. You know, I'm a medical assistant. Be proud of what you are at that moment. Come on. Because the more that you say that you have titles, they try to get more information from you. And then you're going to get in trouble trying to please them. So, again, explain what is it that you're going to do. Why is it that we explain what are we going to do? What was the reason?
So we know what's going on.
Because we asking for consent. This is the answer for the exam. Says, why do we ask the patient for consent? Oh, what do we explain the patient the procedure? Because we asking for consent, remember. They have to consent us, whether imply or express. So if they say yes, if they say something like that, they open their mouth to say yes or no, or ask for explanations, that is expressed. That's a verbal communication. If they write it down, that's still expressed. It's written communication. But if they just nod, remember, pay attention to those questions. As soon as they say imply, that means that the patient is just accepting the things without sometimes doing anything. They just nod. I said, we're going to draw your blood. I'm just going to sit. I'm just going to extend my arm. That's it. You didn't say anything. Imply, remember. Emergency situations are an exception to the rule. If a person is unconscious, how are you going to ask for a response? You assume that this person needs your assistance. For that reason, we assume that you say yes, because you're in a critical condition, right? So there is no such a consent. The consent will be on emergency situations. The consents are always implied. Pay attention to that. Read the question. This is an inpatient. This is an outpatient. This is an emergency situation. So you have to see, they give you actually a tip for you to get the answer. Because as soon as they said emergency, if they asking me for consent, I know it is implied 100%. So that's basically what it is. For minor procedures like EKG, phlebotomy, vital signs, imply most of the time because they just sit there, they just allow you to do things. Now you're gonna do a surgical procedure, you're gonna give medication, you're gonna do some treatment. It's gotta be written. Exactly. So there is no way that you're gonna do imply. Okay, I'm gonna remove your heart, okay? And the patient is gonna say, oh yeah, like I need it, right? So no, that's serious things, very complex procedures, invasive procedures. You need consent, express consent. Communication. If the patient refuses to do an EKG, determine the cause. The cause, why you're refusing? You're not gonna tell the patient, see, be careful, because I mentioned this before. The patient said, I don't want the EKG. So don't tell, why not? The doctor ordered, you're not leaving this place until I done it. No, this is not your kids. So you never threaten, coerce someone to get anything done. Remember what I told you. If this patient comes to me and she doesn't want to do the EKG, I'm going to be so happy. Less work to do. I don't care whatever she reasons what she doesn't want it. But I want to make sure that I tell her, listen, this is important because the doctor needs, for the reason that you came here, the doctor needs to do some evaluations, and that's the only way that he can find what exactly is going on. But let me talk to the doctor and see if we can do it in another time. Give like kind of, make sure that this is like you. Hey, you don't know why this patient don't want to do it. Maybe this patient is in a rush, the patient has to go to another place, now it is there, caught up, with time and things like that. Maybe the patient has something in their body. I have one patient, I'm telling you because these are real situations, why patients sometimes don't want to do the procedure. Not necessarily, if it is needles, maybe I don't like needles. Oh my God, they poke me every single time, I hate needles. And every single time that you do something, you don't get no results. There is always the same problem. And then it says, no, it's not going to be worth it, so I don't need it, right? So they always have excuses, and we have to respect that. Once I have this patient, right, and I ask him to go to get an electrocardiogram. And then medical assistant came over and says, Dr. Hoyer, let's put it Mr. Smith, so I always use the same one. He didn't want to do the EKGs. He says they did one like 3 years ago, and that to look for it, that should be good enough. So she tried to explain the patient, right, and it was important because of the symptoms that he was presenting now, and he refuses completely. Then, when they come to you and we go to the patient changed their minds. But there was something that he didn't want the medical assistant to see. He has something that is called did I forget that? When the breast of the males grows like females. Gynecomastia. Mastectomy is removing the breast.
Yeah.
Gynecomastia, that's what it's called. So then he felt embarrassed, particularly because it was a female that was the one who was doing the test. How do I find out? Because I spoke to the patient. I said, okay, Mr. Smith, this is very important. I need to know, I need to do this EKG because I need to know what's going on. You're presenting with this, chest pains, this shortness of breath, that worries me. So then, if you don't want to do it, then you have to sign me a waiver. So they have to sign a refusal of treatment because there were some signs and symptoms that merits to do this. So I'm going to cover my behind as a medical doctor. Not that the patient said, I don't want to do it, then let them go. No. Now you're going to sign a paper that you didn't want to do it. If something happens outside of my door, it's your responsibility, not mine. So I'm giving you all the information. I said, then the guy went like this, because I didn't know. I was not even thinking. So he says, do you have a male that can do it? I said, okay, yeah, I can find one. We don't have many, but I can get someone to do it. And then I said, I'm going to get those who are doing internship, and I'm going to put them to do it. So then the person went and told me right there, says, listen, what happened is that I have these breasts, and I feel very uncomfortable. And so, you know what? Do me a favor. Do this. I'm going to do it for you. So I did it because I knew how to do it. So, you know, you have to sometimes to understand. Some people don't explain things. Some people might feel uncomfortable. Let's say you have a male nurse, a male tech, and is being asked to go do an EKG in a female, and she has to remove their bra. So, who is kind of willing to do that? Many times, if you are a youngster, you probably don't want somebody to see your breast, or for any other reasons you want to do it. Some females have been, because of breast cancer, have lost they have a surgical procedure. That's the one that I was talking about before, the mastectomy, and they don't want to go there. You see that like they look like they have the two breasts, but this is not the real one. So they have some other things, devices, right? So they feel uncomfortable, and we have to understand that. But if the patient doesn't say anything, so then, we just go by, the rules, the policies. Always inform your doctor that the patient is refusing to do something. Sometimes the doctor comes over, talk to the patient, and the patient changes their mind completely. Because in front of the doctor, the patient, most of the time, don't refuse. And then says, oh, let's do it now. So let's get that out of the way. And then immediately says, okay, let's do it. You know what I mean? But you do your job. So that's basically what it is. Any questions? It is right here in red. I've been saying that all the time. Always command the patient. The instruction should be, Mrs. Smith, do me a favor, remove your clothes from waist up. Now, what if the lady has a dress? Well, we're going to give them a gown. Keep your underpants, your underwear, whatever you want to call. Because remember, they feel very uncomfortable. This is kind of violation of your privacy. So, tell them that. Sometimes I even give them 2 gowns. You have to give them a blanket to protect themselves. Always try to protect their privacy. Remember, females particularly. If a male, you tell them to remove the clothes from waist up, they have no problems with that. Exceptions to the rule, the one that I already told you. But usually, you're not going to encounter a male that is going to refuse to remove their clothes from waist up. Believe me. So, that's what you have to do all the time. So, make sure that you actually, provide patients with a drape, a sheet, blanket, hospital gown, opening to the front. This happens so often. Can you remove your your clothes from your waist up? Then put this gown. But you don't tell them what way they should be putting that gown. Remember, we're going to be using the chest. For that reason, the opening has to be to the front. Tell them to sit there. Hey, let me know when you're ready. Offer your assistance if you have a patient who has certain disabilities and they are by themselves. Is that understood? Because sometimes it takes a little longer for them to remove their clothes. May be very difficult for them. Offer your assistance. Said, Mrs. Smith, Mr. Smith, if you need any assistance, let me know. I'm here behind the curtain, behind the door. Just let me know. Don't go there, oh, you're taking too long, let me see. And start, no, don't go there, touch the patient. Don't do anything without the patient's permission. This is very important. Remember, this is HIPAA. Patient's privacy. You have to give them space. If this is the room where the patient is going to change, if you don't have curtains that separates the bed where the patient is going to be doing the exam, or else you step out of the room. Mr. Smith, Mrs. Smith, I'm going to give you some time for you to change. I'll be right back. I'm going to be behind the door. If you need me, if you need any assistance, let me know, please. And if he has curtains, then pull them close and you start entering the information in the machine, saving time. When the patient is doing all this, I'm preparing the stuff that I'm going to need, including entering the information in the machine. So when the time comes, see, you didn't waste no time. How long is going to take the patient to change? Between 10 to 15 minutes. That's the time that you're going to use it over there, preparing all the things that you need for your procedure. Checking the paper, making sure that the machine is working, you connected, that it turns on, the paper, the electrodes, the alcohol pads, you have everything. Remember, tell the patient to put the opening of the gown to the front. Otherwise, it's going to be. Have patient remove, I already explained you yesterday. You see the patient when they comes in, and they have all these metal change watch with a metal wrist and all that stuff. Remove it, remove it, remove it, and place it right here. In a place where they can see their stuff. Is that understood? Their wallet, their case, whatever they have within, change, rings, whatever. What about piercing? You can ask them to remove the piercing? No. It doesn't matter. No, there are some of them that they can just...
Yeah, some.
Don't ask them to remove it, and even worse, don't try to remove it yourself. It has nothing to do. There are some piercings that are very private, in the belly, in the nipples. Oh, let me remove that because it's going to do... No, you're not going to touch no one. And it's no need to remove the piercing. Even though if it is a little ring that is hanging out of the nipples, leave it alone. No, isn't it real? People put a lot of stuff.
I had a lot of facial piercings.
Yeah. So now, well, I have to explain it to you, because if you don't learn it that way and you find one of these person that is, wearing all this stuff, and then you're going to say, oh, what am I going to do with that? That's metal. That's going to make interference. No. Leave it alone. We're talking about phones. We're talking about watches. We're talking about belts. We're talking about chain, something. Now, they have a little tiny earrings. Are you going to ask them to remove it? No. They're actually going to lose it. They don't even know where to place it. No, if it is very little, there are some little things that they put right here. How's called that thing? I forgot. But they just have a little... Just a little, yeah.
I forgot what it's called.
Yeah, you see?
It's really tiny.
I know. That sometimes even the guys like to put that one in the ear. So no, leave them alone. Oh, you have something inside your tongue, remove it. Let me pull it out. No.
Some piercings been in there so long they can't come out.
Yeah, no. That is no way that, you're going to do that. So be careful. All electronic devices should be turned off and removed from the patient. Particularly now that everybody carries a cellular phone. Back in the days it was beepers, but that thing is no longer used. I used that like 2 times maybe. Because I was on call, and well, they gave me that thing that I didn't know how to use it, and that thing was buzzing and all the stuff, and I saw a number. I said, no, I have to run to look for a phone and call. No. Anyway, but then, cellular phones came about, and they said, oh, better. But everybody carries a cellular phone, carries a tablet, and most of the time you leave your cellular phone in your pocket, ask them to remove. Be clear, says if you have do you have a cellular phone on you? Oh, please put it right here, please put all those things. Tell them in a nice way. If they forgot, I have a medical assistant that a patient forgot and left some car keys or their home keys, and they were there, and they did some interference, right? Oh, why didn't you tell me? I told you already. to remove everything. Remember, these are not your kids. Sometimes the patient is younger than you or older than you, but regardless of that, you do not talk to them like that. So very professional. Oh, I know. Can you check over there if you have you still have your cellular phone over there? You have something else? Do you have any medals? Your wallets? All those things has to remove. The belt, remember. So, because all of this is going to make interference. How the patient should be positioned when we're going to do an EKG. Supine position is called. That is the elevation of the head. Correct. So supine position. And what is supine position? Facing up. Because you're going to use the front part of the body. So that's called the supine position. It's in red. Why? Because this is us. They ask you this. Now we're gonna see like more than 180 questions. So you're gonna say, Professor, you said that it was 120. Yeah, because some of you are gonna have one question, some of them others, and so on and so forth. It's not the same exam. So some of the questions will be similar, and it will be randomized, right? But others will be totally different. And some of you will have some of those, some of you will have some of the old ones. So that basically. Now, very important. When you position yourself, remember it's not the patient. The patient has to be laying down on his or her back. That's called the supine position. Is that understood?
Yes.
Now, if we have one of these clinical beds or tables, you have to raise the size where is the head. Remember, do not keep the patient completely flat, particularly these patients who have respiratory problems. If you have a respiratory problem, usually the question reads like this. You have a 40, 50, 60 years old person is a patient with respiratory problems and you're gonna do an EKG. What is the correct things to do positioning the patient? Then you're gonna elevate the head of the bed 15 to 30 degrees or 45 degrees, it doesn't matter. But look for the question that you're gonna raise up the head of the bed. Because if the patient is completely flat and the patient has respiratory problems, they're not gonna be able to breathe normally. And when you place them in that position, they're gonna start like they starving for air. Well, the EKG is gonna be wrong because they're not having enough air. For that reason, they're not having enough oxygen. If they're not having enough oxygen, start moving. And if they move, you're gonna see all these extra waves on the EKG. Now I'm not gonna be able to read it correctly because there are something else that is not allowing me to see the real waves of the EKG. Now it said right here, work from patient's left side. That is you. When you stand next to the patient, we have a bed right here, my patient is laying down, I should be positioned on the left side of the patient. So if the patient's head is right here, I'm gonna be here. If the patient is right here, I have to be over there. Why is that? Why it should be on the left side? What happened to the heart? Correct. Because the heart is on the left and most of the electrodes that I'm going to place are going to be on the left. So for that reason, I'm not going to be over there and placing it from there. Remember, you should not go over the patient. If my patient is laying down here, I cannot go to the other side to place things. I have to go around. But if I have like 7, 8, okay, 6 right here, 7 right here, 8. And there are 2 only, I have to go around. So from the left side, I'm gonna have 8 electrodes that I'm gonna place. Versus on the right side, that I have only 2. So I start, you should be standing. This is a question for the test. When you are giving an EKG to the patient, or when you are processing an EKG on a patient, where should you be standing? That's what they ask you. Left side. They're not going to ask you why, but we have to explain why you have to be on the left. Remember, because most of the electrodes are going to be placed on the left because the heart is on the left. So it makes sense, right?
Yes.
Good. Ensure that the arms and legs are supported, not hanging off the table. See, sometimes, have you seen these doctors' tables, office kind of beds?
Yes.
That you have something that you can ride with an extension?
Mm-hmm.
Well, make sure that that extension is pulled out. Because if the patient is tall and the feet is kind of hanging on the side, not good, because the patient is doing a lot of pressure to kick the foot to kind of up, right? Not hanging. So that's what you do. So you pull this extension, you cover the table with paper or with a blanket, whatever you use over there, because every single time that you have a different patient, you're going to remove that, right? It's going to be clean. So that's basically what it is. Another thing, probably later on, the table that you're using, remember that bed over there? It was against the wall. Don't place those tables against the wall. Now, why is that?
What tables?
The table, when we see, let's say this is where you place the patient, right? Or the bed. Should not be against the wall, touching the wall. Why?
No electrical.
Correct. Because we have all these electrical cables over there very close on the wall, and that can have interference with the job that you're doing. So see, all those things that you're learning, and oh well, maybe you already learned, and I'm doing this just for fun with you
No,
guys.
I'm not with you.
No, but it makes sense, right? It makes sense. Because we're going to talk about all these interference that we're going to have when we are doing an EKG. And you're going to notice, because I'm going to show you the pictures, how they're going to look like when there is interference with electronics, with the electrical impulses, when the patient is moving, when the patient is cold, when the patient is shivering, when the patient has Alzheimer's that is moving, whether it's voluntary or involuntary movement of the skin. So we're going to see that because you will have those questions, but then you will have then written questions in multiple choice, and you have sometimes the little picture. The picture below or the image below is representing what kind of artifact. Artifact is trouble. What is the problem? Then as soon as you see it, I said, oh, I know what it is. Why? Because I'm going to show it to you. You know already whether the patient is moving, whether there are electronics or electrical devices next to the EKG machine or the patient, or the patient is just moving, the patient is cold, or you didn't attach all the electrodes, all the cables. You put the electrodes, but you didn't attach it to the cables. You're going to be seeing certain representations, and you're going to say, oh, I know what it is. But you have to see it first. You have to kind of be exposed to it. Otherwise, you wouldn't be able to understand. See? Provide a blanket to the patient. Remember, it's like here. These rooms, we mentioned this yesterday, right? It's a little cold. Well, it's not cold for me, but if you leave me here, I'm talking, so therefore, I'm kind of using some energy. I'm a little warm. But if I was sitting like you there without movement, after half an hour being exposed to this air conditioning, you're going to feel very cold. Now, on top of that, I'm going to ask you to remove your clothes from waist up. Then, you're going to be colder. So we're going to give you a blanket for 2 reasons. To warm you up and to cover you up. So, for privacy purposes, besides the gown that we gave to the patient, we gotta give them a blanket. Is that understood? So it's very important, because other than that, we're gonna have a problem. Make sure the bed exam table is not touching the wall for electrical. Remember, because we have electrical stuff or equipment that is electrical should not be next to it. Remember, yesterday I also mentioned it, that when you go to a medical doctor's office or the hospital, you have all these signs like that one over there. No cellular phones, no electronics. That's for a reason. It's not that we don't want you to be talking on the phone. It's the interference that these electronics poses to these machines when we have the patients with exams, with testing, with medications. Is that understood? All these devices can be kind of blocked, if you will, with the interference of these electronics. Ensure that the patient is not touching the bed rails metal. If you remember that bed that was there, the rails, meaning all those kind of fences that we put on the sides of the bed for the patients that are admitted, because we don't want them to fall, right? These are metal. So if they are touching this metal, it's like they're having metal on themselves. So it's going to be interference. So that's basically how all these work. Let's talk about the leads. How many leads an EKG has? How many leads? 12 leads EKG. How many electrodes are we going to place on the patient's body? Oh my God, you guys passed that phase. This part of the EKG, remember, it's not a lot on the national exam of medical assistant, but as I can see, this part is not going to be a problem. So pay attention to all that. But this is where all the things that you're going to be doing at work. So learning these leads, this part of the equipment that you're going to be using. So it says right here, we're going to have the chest leads, but we also have the arms and the legs, which are called the limb leads. Limb leads, or the extremity leads. Most of the time we call it just the limb leads. It says right here, usually brown and labeled V1 through V6. Well, this, how can I tell you this without sounding that the publishers don't know what they're doing? Well, back in the days, this, you see that these have colors?
Yeah.
Well, that's how it is now. Everything is color code. And it's really good, particularly for me. Why? Because the labels are there. Each of these leads, these are the ones that are connected to the electrodes. This is like a little clipper, a little alligator, and comes in, click right there on the electrode. So this comes color code now. So it says right here that the chest V1 to V3, they are usually brown. That was the way it was before. Now each lead, V1 comes one color, V2 is another color. So I see you doing the EKG over there. From here, from the distance, I cannot see this. I cannot see the labels because each lead has a label. How are you going to place it? How are you going to know this is V1, V2, V3, V4, V5, V6? Because it has a label. But if I'm here looking that you're doing, I know if you misplace it just because of the colors. When we have problems with our vision, like me, I don't even know who's standing right there. I know there are some people sitting there, but I cannot recognize you. Sorry. So, if reading the labels is a pain for you, learn the colors. Learn the colors. One of the things that I always recommend my students is, if you have glasses, prescribed glasses, wear them. Is that understood? For many reasons. So wear them because it's gonna save you lots of trouble. Because sometimes we can see far, but we cannot see very close. try to read this little letter, you don't see it. But if you see from there an image, a window, a building, a car, a color, something, you can see it. But it's small stuff. Only you don't see it. So wear your glasses because it's going to come very handy right here, because these labels are very small. So when you see them, if you have a good vision, then you will be able to see them. But if you don't, then once again, use colors. I like to use the colors. This is a lot easier. So it says right here, limb leads. These are lead number 1, lead number 2, lead number 3, ABR, ABL, ABF. But this becomes 4 because remember we have the bipolar. Chest leads 6, B1 to B6. The other one are divided. Remember, we have the bipolar standard 3 leads, right? The augmented 3 leads. But when we combine them with the bipolar, and because kinda the electrical impulses overlaps, we just have 4 instead of having 6. That's what we use, 4 electrodes. It's in the conversion of the electrical impulses, but at the end we're gonna have those 12 leads. So that's basically what it is. So here, I want you to learn these colors. You must know these colors of the limb leads, the arms and the legs. So right arm is gonna be what color? White. So make it simple. Right is white. What is the opposite of white? Black. So white, black. White, black. Remember, that's how usually works. Now we have 2. Now I have my leg, my 2 legs. The right leg, we saw that, we covered that yesterday, that is always green. Green. Right leg is green, left leg is red. That's what I want you to do all the time, because if you don't do it like that, then you're gonna forget. White, black, green, and red. That's it. Because they're gonna ask you, the right leg is what color code? Green. The left leg, red. The right arm, white. The left arm, black. That's it.
I have a question. So these are like the official colors. Like, say if you go to a different clinic or something, and the colors are different colors.
No, they are standard.
Right.
Those colors don't change.
Okay.
The machine might change, the brand, the features. It has a big screen, maybe a small screen, maybe single printout, maybe multiple, but these colors standardize. It's like the color of the tubes. They should not change, because that would be difficult. No, but that's a good question.
Yeah, it is.
But can you imagine, these exams are national exams. So someone who is in California is using a different textbook, and they tell you, okay, these are different colors. How do they know which test sent to New York? This is online test. So these are standardized colors. And it is good to have standardized things, because then we know whether I work in this clinic or over there, or I move to California, or I move to Florida, we follow the same. Being said that, remember the certification that you're going to get here when you take the national exam, as the word implies national, you can go to any state within this country and you can use it. You can apply as a medical assistant. They're not going to ask you, okay, what school did you went to? Oh, I went to New York school. What certificate you have? Oh, I have this national certificate. That's it. That's all it matters. That's all it matters, because it's national. Whereas if you have a license, licenses are state-wise. So if you move from here to Florida with a doctor's license, you can practice over there. You cannot. You have to get a license from there. So certifications, you can work everywhere because these are national licenses at state. So, see the advantage of you moving here or there because we move. I wanted to move to other state, but then thinking that that state is going to require me to take another exam, to go through all these processes and all that. I'm like, oh, no, I did that once, but this is enough. Remember that there are other states that accept your license because they have an agreement with the state. Have you heard about that? That is called reciprocity. Questions for the exam. Oh my God, why am I giving all these questions? It's that I have it right there and it's killing me softly. So I need to pull this out. I feel good because I'm giving you what you need. There is nothing worse. Listen, I went to the school. Not long ago I finished. I do lots of things because I like to be up to date. I like to be in the market. The more you know, the better for you. More opportunities, right? So one of the things that I hated it my entire life was taking tests. Because I consider really good doing things. Show me how to draw blood, I do it. Show me how to do an EKG, I do it. Show me how to build this or that, I do it. But if you give me a book and you ask me to read it, first of all, if I'm reading, I fall asleep. If I want to go fall asleep in my home, take a book. I don't have books because I don't read. But I take these books from the school that they gave me because I have the electronic version because I hate just carrying, listen to me, and carrying a book and it's like. So I keep it at home because they give it to me. But I have access to the online version, right? Which is the electronic version book. So I have it there and it goes. Sometimes I want to review some stuff because there are new things, new trends. Instead, I'm going to read something and I'm going to read and next thing I know, boom. Okay, good. So when I want to sleep, I know how to do it fast. But exams, I hate them. I do definitely hate them.
Like on my third day of work, they was like explain how to do vitals, and I was stuck. Like I couldn't. But then the lady, like, she was like, let her do the vitals.
Right.
I did it correct, but when it came to explaining what, like...
No, sometimes that happens. That happens a lot. That's why you have to have, as a teacher, you have to have different techniques of teaching. It's not what made me feel comfortable. It's not what I know or think that you understanding everything that I'm saying. So you have to look for different wording, scenarios. I don't know. It's kind of put myself in all of you. It says, they probably going to understand me this way, that way. That's why I become like a little clown sometimes explaining things. Because I want you to get the stuff. And sometimes using these common terms, layman terms, easy way of you seeing things, because there are many of these terms that we use are very big terms. And this is the first time that I'm hearing about that, and you talking with them and using those terms, I'm not getting it. So you have to kind of go a little easy, you know what I mean? And it is for everything. For everything. You know something really well. See, you probably guys know something that I don't know, and you using your terms right there in culinary or in beauty or in some stuff, and you start talking about that, I'm gonna go like, but see, what is it? No, tell me, it's this, it's that, it's this, and they, no, because I'm not familiar with that. But if you explain it to me differently, or you kind of demonstrate how you do it, then I will get an understanding. So it's not like, oh my God, have you heard sometimes that we call ourselves, oh, I'm so dumb, I'm so stupid, I don't know what, I'm not getting it. You see other people kind of answering the questions and all that stuff and participating, and the other one says, oh my God, how she knows so much, or how he knows so much. No, some people just get things one way, some others other ways. Sometimes certain subjects for you might be a pain, some others you get it very easily. That's how it is. Not everybody learns the same way. I give you a task to you, the same to you, the same to you. Each one of you is going to complete it differently. You're going to use your own ways of doing things. But sometimes we have to follow certain rules, right? So that's basically what it is. So be careful with that.
Wait, reciprocity?
Yeah, reciprocity. What is reciprocity?
Can you spell that for me?
Sure. No worries, that's not something that we use all the time.
I don't know how to put it into words, but I know being reciprocate is like I give to you, you give to me.
Right.
But I don't know how to put that into words.
Now, I'm gonna give you an example. I'm licensed here in New York as a medical doctor, right? Now, I wanna move to Connecticut. Connecticut has a reciprocity law, meaning that if I work here, my license is gonna be accepted over there without going through any processes. I don't have to take a test. Or the only thing they're gonna do is they're gonna register me over there as a new doctor over there. That's reciprocity. When one state receives your certification without going through all these processes. It's like I'm living in New York, but I moved to Connecticut. Nothing changed. It's just me physically moving to another state, but my license is accepted over there. Is that understood?
Yeah.
If there is no reciprocity, what happened? I'm here like in Florida. I have a job offer in Florida, and they will pay me very good. But then, when I have to go through the process, they said that I have to take another exam. I have to pay $600 at that time, and the exam is 400 questions. There are 5 hours exam. I said, I'm not gonna go through all these for $10,000 more. No, I'll stay here. In less than 1 year, I was making the double of the money that they were offering me there. So I said no. So reciprocity is when you are in one state and you are licensed in this state, but your license is accepted on the other state.
And so forth, like there are people
They're
who are
correct. Connecticut people can come work here in New York without not having a actually New York license. Connecticut license for you. New Jersey is the same. Kind of the 3 states right around here, we have reciprocity. But other states, no. So now having a certification that is nationally recognized, that's a different issue. So that's an advantage. So, yes.
What about endorsement? Endorsement?
Okay, endorsement is a different issue. Okay? Endorsement is that you kind of what is, no, it's not patronage. I don't know what it's called that. Okay, let's put it this way. A check. You're going to endorse a check. Or I'm going to endorse you. I'm recommending you. I'm going to put my signature. My name is going to be there. I'm endorsing you something. That's basically what it is. So endorsing is that your university, the place where you work, it gives you a recommendation for this place to take in consideration that you have experience here and that they going to kind of accept some of the requirements that you need. So it's like, hey, let's put it this way. This school, you're looking for a teacher, and you're a teacher and I know you. Oh yeah, no problem. So let's say that I'm endorse you, it's a recommendation. Think about it, it's a recommendation. So let's say that you are a teacher, right? This school is needing a teacher, and I work here, and I know you, and I said, I'm gonna recommend you in your school. So it's almost guaranteed that you're gonna be getting the job. So I'm endorsing you. Right now, you can see in the political campaign, somebody is endorsing someone. I'm with you. I'm supporting you in everything that you want. That's an endorsement. So for titles, endorsement means that this state recommends you with that state. So they give you like a recommendation. They said, oh, this person mentally educationally and ethically, you are recommended and they can take you in consideration to give you this job. So that's an endorsement. Clear? So most of the things you have to do is a recommendation. It's like professional recommendation, personal recommendation. Think about, do you follow like the politics somehow? I don't like politics. I don't like to talk about that. No, we're not going to discuss. But it's like these people supporting either of the parties, see? Or like these celebrities goes there and says, hey, I'm going to support this candidate or I'm going to support this candidate because they kind of connect with the ideas that, whatever they're going to accomplish. So it is a recommendation. It's not that you're going to bypass all the requirements. No, but they're going to take you more in consideration. It says, oh no, they've been recommended by this person, so it's endorsed by this person, so let's give them the opportunity. They might allow you to work. They give you permission, and while you get all your paperwork done, or you pass the exams, or whatever else. Or they can even waive you the exam that you have to take to kind of practice in that place, because it's not reciprocity. Any other questions? Okay, so let's see what it says right here. Where on the body should V1 electrode? Well, not yet. We saw yesterday a little bit, right? But these will be questions at the end when we have done the EKG and all that stuff. But we already learned where V1 should be placed. Remember, V1 is the only lead that is going to be on the right side of the chest. Remember, V1. Everything else is going to be on the left side. So V1 for intercostal space, right side of the sternal border. So that's basically what it is. Now the reason why this question is there, because it comes from your exam. They like to ask where is V1 located, because it's on the right side. Everything is on the left side. Not that the other leads are not important. It's just that this one, because it's on the right side, they really want you to know that this is. And that's like a giveaway for you. They said, okay, which of the following leads is located on the right side, or B1 is located where? So that's basically how it is stated. Any questions up to now? Okay, so let's recap these colors of the limb leads. What is the limb? What is limb leads? What is limb? Arms and legs. Back in the days, we used it's always the term extremities. This is extremities, attachments to the base. So limbs is more like medically speaking, right? So for that reason we use limbs. So the right leg, what color is the right leg electrode?
Green.
Green. What about the left leg?
Red.
This one you should not forget it. Right is?
White.
Left is?
Left.
Correct. Remember, they're not going to ask you V1 color, V2. They're going to ask you where is V1 located, where is V2 located, where is V3 located, V4, V5, and V6. So, remember that at the end of this program, when you finish your internship, you get ready to go to take the national exam. Let's see, I'm going to talk to the director because I get along with him. So, and see if we can do like a class to do a review.
Me too.
Okay? Most of the time, it's not review going over the chapters. No. It's review with questions. Start playing with a bunch of questions that more likely are you going to be seeing. So to refresh your mind. So when you go there to take the test, you kind of listen 70% that you have to get from there. I don't want you to panic thinking, oh my God, am I going to remember all these? You're not going to remember all of them. But as long as you pass, you need 70%. That is it. Not at all. So you have 100 180 questions and you pass 100, you pass. Can you imagine almost half of the questions you answer right, the other ones no? Because sometimes you say, oh my God, I know some of them that were right, but others no, I think that no worries. Because probably the ones that you didn't answer are the ones who are not applying. You made your 70%. So that's the most important thing. So for now, just giving you information about what might be from this chapter, and then we'll see what else is there. Says right there, where is an acceptable alternate site for electrode placement on an upper extremity? Now, remember that I told you yesterday, it can be two sides. Most commonly on the upper, remember these are the upper extremities, the upper limbs. So when they talk about upper limbs, we talk about arms, right? When they talk about lower limbs, we're talking about legs. Get used to these terms because sometimes we know, but sometimes we just taking the test, we get a little confused. So on the upper arms, on the upper limbs, here usually is the place when we like to put the electrode. That's close to the wrist, both arms. But we can do it right here, remember, on the upper arm. Or we can do it on top of here, right here by the collarbone. So we can do it right there. Because if I'm going to give you an electrocardiogram and you have no arms, or you are having this EKG that you're going to be taking home, then I don't want to put it in your arms because then you're going to have some movement, and that movement is going to come out on the EKG. Said shoulders, deltoid. So it's not actually the shoulders. It's right here in your arm, the upper arm. Upper arm. You're going to do that. We're going to practice it right here by the wrist and by the arms. And we're going to go over if the patient is missing a leg from waist down, where you're going to place it? Right here in this part, the inguinal part. So that's how we are going to kind of explain things. Because when you do it, you tend to remember better. So I'm going to tell you, okay, this patient doesn't have the lower leg. So it is amputated below the knee. Pay attention to all these terms. Below the knees, from here down. Above the knee means that the knee is not there. Because remember, some patients, they just cut from here down. Might be here, might be here, might be here. Some of them might be here, might be here. Some of them completely no leg. So where are we going to put those? But just in case you have a patient, right, that might be missing one or both legs. Remember, if the patient misses the leg completely, I'm going to put one electrode right here on the inguinal part, but the other one, where it's going to go? In the same, at the same direction on the other side. Oh, no, but the patient has the leg. Let's put it over there. No. It goes horizontal to it. Because this is the type of exams that you're going to have. So the question is going to read as follows. You have a patient that you've been asked to do an EKG, but it has a below the knee, right knee amputation. Or from the hip down. Or the right arm, or the left arm. So then immediately, if I don't have this arm from the shoulder down, I'm not going to put it right here on the deltoid. I don't have it. So where should I put it? Right here on the chest. Right here, below the collarbone. Right there, like in the middle.
What you call this again? What you said this called?
Hips.
Put it on the hips if you haven't got no legs.
No, the inguinal part. Right here,
part?
this part.
How you spell it? I'm sorry.
It's not, no worries. I mean, this is a gym.
Thank you.
You're welcome. That's the inguinal. This area right here. that connects right here to the genitals. That's the part that we're gonna call it. Not over the bone, remember. It's right here on this fleshy part. So that's what they did to you, Danielle?
Kiana.
Oh,
You're fine.
oh my goodness, no.
Yeah, that's what they did to me when I had my asthma attacks.
Yeah. Once again, but that's not because you were amputee.
Yeah, no.
It's because they were lazy, and they saw, oh no, let's put it right there, and that's yeah. Well, let's. So, but still, it's not round on.
Yeah.
You know what I mean? Because it's an alternative. It's an alternative to put it here. It's an alternative to put it here. Depends on the situation. I use it most of the time here instead of here because the patient starts moving. Anytime that you put the patient right here and you tell them, Mr. Smith, Miss Smith, I'm going to print the EKG. Please stay still, breathe normally. Now they want to scratch. Now they want to move. Now, isn't it when you tell someone not to do something, then it's like mentally you're telling them, hey, do it. So, but you have to tell them. So that's basically what it is. So that will be the deltoid. I do that most of the time for my patient because I don't want to, run the chance that, if I put it right here, I have to repeat it or I have to tell the patient, oh, don't move. Remember that I'm going to, no time. Again, OSHA, infection control, we have to watch our hands all the time, remember. Follow universal precautions. What is universal precautions? Using all these personal protective equipment. What is the personal protective equipment? Gloves if needed, mask if they're needed, face shield if it's needed, a gown if it's needed, whatever equipment. You make the judgment, depends on who you have in front of you. If you have a patient who's coughing, well, first of all, I'm going to give my patient a mask, and I'm going to put my mask. If the patient don't want to use it, no worries, I'm going to protect myself. Is that understood? First me, and me. What? You don't like that idea? Okay, watch your hands. Watching your hands, you probably learned it in phlebotomy. It's the easiest, simplest, more effective way of prevent cross-contamination. And it's going to be on your exam, national exam, definitely. Wearing your personal protective equipment is going to be there. So, very important for you to understand that. Now, they usually not gonna ask during the pandemic. They were asking, for how long do you have to wash your hands? For how long? I didn't say you should wear a mask. See, people take it personal now. Okay.
Is it 60 seconds?
30 seconds.
30 to 1 minute. 30 to 60 seconds. So that's basically, oh, wait a minute. No. 15 to 20 seconds. 15 to 20 seconds. That's how long. That does not count for the moment that I remove my rings from my hands. And no, it's when the time that I wet my hands, I put the soap on it, start myself scrubbing around. Remember, the fingers should always be pointing down. Because you want all the dirt. Of course, nothing. You see, in the pandemic, we learned a lot. People thought that they knew how to wash their hands correctly. Remember, sometimes we create bad habits. And we don't do the right thing. We go like, as soon as you wash your hands and you dry. No, that's not how it is. Another thing, when you open the sink right here, see? Let's say that this thing is not plugged in.
Yeah.
But let's say that I open it up. At the beginning, I open it up. I don't have to wear anything because my hands are dirty. This is dirty. This is contaminated already. So I open this. I mix the water at the temperature that I need it. Because remember, you're not going to get burned or it's not going to be too cold, right? Now it's the temperature. Then I wet my hands. Then soap. start scrubbing in between my fingers, my nails, and the wrist, the palm of my hands. That time is gonna take 15 to 20 seconds. Then I rinse right there. I don't touch anything in the surrounding because I'm gonna contaminate myself. So when you finish rinsing your hands, what are you gonna do? You grab a tissue, then you're gonna kind of dump that, kind of scrub because it can, all these tissue is gonna be stuck in your hand. So then, what are you gonna do next? Remember now, another tissue, and now you can close this with another tissue. At home, we don't do it like that. First of all, we don't even use tissue, right? We have a towel there that has been there like for a month and already stands up by itself, the towel, because it's all dirty, right? And yeah, well, our home, but we're not worried about our home. Here we have patients. We have sick people. So we have to do things differently. And when you wash your when you set your hands, what do you use to dry your hands? Has to be disposable paper towels. That's the answer for your questions. How you gonna dry your hands? What you gonna use then? Disposable paper towels. It's not a towel. It's not a sterile towel either. This is not sterile. It's just a disposable, the regular ones. That's it. Wear gloves when exposure to blood or bodily fluids is likely. When you draw in blood, always. It doesn't matter who your client is. I work with these doctors, right? A lot of them. Some of them, at that time, I was like, when I graduated, I was like 29, 30s. So these people were like 40, like 60s and something like that. And they didn't wear no gloves. And they were cleaning a wound. You know what is a wound? That has pus, that has all these things that was smelling nasty, no mask, no nothing, and doing all these things. And wait a minute, that's not enough. They finished right there, they didn't wash their hands, and they moved to the next patient. Haven't said anything yet. Wait a minute. They go to the lounge area, remove their food from the refrigerator, and eat it without watching. I was like, oh my goodness, these people, what is wrong with these people? You have to wash your hands before and after procedure, before and after you interact with the patient, before and after you operate a machine. That EKG machine is contaminated. How many people use it? You're not the only one. So this equipment in our office, everybody's touching it. How do you know this person washed their hands? How do you know that this equipment was clean? We have EKG machines that nobody clean, ever. They actually have stains of every single thing imaginable. So there are lots of microorganisms over there that can pass to us, that we can pass to the patients. But the worst part is that you can get it yourself, you go home, and you pass it to your family. So that's how we can cause and bring all these microorganisms at home. For patients in isolation, follow the standard precautions, special standard precautions, because we're gonna use different types of masks, right? Like N95.
That's the one that come right here and come down, and we use that for the jumpsuit.
Yeah.
Like these things.
In isolation, yes. Yeah, to do all that. Do they have a shower there when you finish? See? So you're not gonna have a problem with that, with those questions. So important. So in isolation, you're gonna use the N95 mask. There is a special mask that it has to be fitted to your face. It's not any mask, because you don't want anything that goes through the mask that can cause you a problem. So whenever you see the word isolation, airborne infections, N95 is the answer. How do we transmit COVID? Oh, I gave you the answer. How do we transmit COVID? Oh my God. What is the way, what is the mode of transmission of COVID?
Airborne.
This is airborne, but coughing mostly.
Yeah.
Right? When we open our big mouth to sing, to talk, but particularly coughing, because that is when you kind of sick, right? You're getting this cough out. So that's basically what it is. What are you laughing? So that's basically what it is. So,
I hate that mask though.
well, but for our own safety, right?
Yeah.
I have no problems. I can sleep with a mask.
Mm-mm.
No problem at all. Sometimes I even forget to remove it. Because I'm so used to it. Since I remember, I put mask on. So I'm used to. Now, the whole thing that, you know, they use for isolation, excuse-moi, but that is not something that is very uncomfortable. Because you feel like you are kind of, you know,
And it's
in
hot.
case. Oh yeah, that's what it is. It's encasing that there. But you gotta do, because, you know, if this patient has an airborne condition like tuberculosis or this COVID on these later stages, so you have to protect yourself. We talk about this. Make sure that you have the right patient. So, can you imagine doing the procedure on the wrong patient? Raise the bed rails if available. That is when you are in an inpatient setting. Remember that bed that we just removed from there has the rails on the sides? So whenever we go to the patient's room to draw blood or to do any procedure, we lower those, right? So we can get access to the patient. But as soon as we finish, what are we going to do? Raise them back, because we don't want this patient to fall. So that's the reason that they place those rails over there. Other than that, pull out extensions from legs and feet using the exam tables, the thing that we were talking before. Remember, the patient's tall. Don't let the foot or the feet or the legs hanging out, because some of the procedures are not going to come. And you get tired, like trying to hold it right there and the pressure and all that stuff. We don't want that. Chest grounding plug for security. Now, once again, when you plug the machine, make sure that it is correctly plugged. Remember those extensions cords. Try not to put two different devices plug it in at the same time that you do, because one is interfering with the EKG machine. So that's basically what it is. Safety, safety. Ensure that the bed or the table is not touching wall or electrical equipment. We talked about that already.
And it's locked.
Right. Oh, that's another thing. That's the one that has wheels, particularly for the patients that are inpatient, needs to be locked before you start doing anything correct. Ensure that the patient is not touching the bed rails. We know that, or the exam frames for safety reasons. Check insulation wires for cracks. We are talking about this. No worries, leave it there. It's just right here. Because these are the cables that we are going to be attaching to the patient's chest, arms, and legs. And guess what? Like these chargers, we break it, we twist it, we do so many things, we step on it. Because if you don't kind of handle these cables correctly, you're gonna damage them. So this is an equipment that we're gonna be using over and over and over. So we have to take care of these cables. We're gonna see those cables when we are ready to do the practicals. I'm gonna show you every single detail from them to make sure that you kind of, revise them, check them out before you use it, because it might be damaged. It might be broken. And now you're not getting the results that has nothing to do with the patient, has nothing to do with you, but the equipment that is not functioning properly. So that's very important. True or false? Universal precaution should be practiced on every patient when performing an EKG.
Yeah.
I know you don't know the answer, but I'm going to tell you what it is. It says right there that it's not, just kidding. So, every single time that we are performing any procedures, we have to use universal precautions, standard precautions. Meaning, we're going to wash our hands and we're going to use any personal protective equipment needed for that particular procedure. Remember, when we're using an EKG, you don't need to wear gloves. You don't put yourself gloves. Because now you have these electrodes that are like stickers that have some glue in it. Mm-hmm. They're going to stick on your gloves. Oh my goodness, you're going to have a problem. So you don't need, but you need to wash your hands before and after. Remember, this is non-invasive. Now, the patient has a bunch of lesions, things like that. You might be exposed to blood or whatever. Then you wear gloves. The patient is coughing, then you wear a mask. All depends on who your patient is and in which condition your patient is. Is that understood? Mm-hmm. So you make the judgment. Always. You enter in a room and you see that smells really bad. It's logic. You immediately react to it, right? Smells really good. Are you worried? No. So then you make the call. So that's basically it. Before the EKG procedure, identify and communicate with your patient. We know that it's before, not in the middle of the procedure or after the procedure. Oh, what is your name, by the way? And you waste all your time. Prepare patient and room. Before you bring your patient to the room, make sure that that room is clean, doesn't smell bad, that if a patient before has used the table is clean, new paper is placed on the table. Remember, we call it table, but it's the little bed that we have over there. It's an exam table. So make sure that you pay attention to all that. If you use blanket, the blanket has been removed and a clean one is being used. If you have a pillow, also that those pillow cases or pillow covers are clean, not the same one that is being used since you remember you started your job. So when you started your job, it was white. Now it's brown. Now go to some places and you will see. You see the stains over there.
Yeah.
So come on. Yeah. Locate and check equipment. Always, this is before. Make sure that your machine works. Plug it in. Turn it on. Make sure that it has paper. Make sure that all the little clippers or alligators and the cables are in good condition. Make sure that you have the electrodes. That the electrodes are fresh, are new. They are not expired. See, all these have an expiration date right here. Comes in a package. You open this package, in each package you're gonna find one little paste with all the 10 little, here there are 10 packages, individual for 10 patients.
Okay.
It's not that I'm gonna remove one from here, one from the other, no. One is for one patient and try to use it wisely, because if you miss one or something doesn't go right, then you have to remove another from another one, so that is not complete anymore. So that's basically what it is. Load the paper if it is required, because you have to pay attention to what you do. This is the first time that you go work over there. Don't assume that the machine has paper. Go check it out. Ask someone else if you don't know how to operate that particular machine. You know everything else, but the machine is new for you. You don't know. It happens to me all the time. Attach the electrodes and leads. That is after you have your patient over there, but you have everything working properly. Newer multi-channel. I mentioned this before. The older machines, they did it individual leads. Lead number 1, then lead number 2, and all of them in sequence, in one strip. A long one, and then you have to cut it and paste it. Some of the places still have those. Because, why? Because they are cheap. They don't want to change. I have worked with doctors that, to be honest with you, they still have a typewriter. Yeah. I have seen them in the museum, but I've seen in some doctors' offices. Because they are like 90 years, 100 years old, and they don't know how to use computers. And they say that computers are not needed. And they still writing the medical records in paper. You want to go to one of those doctors? You want that doctor to be your doctor? I can recommend it to you. So now all these 12 lists appears in one page. That's it. You have one, and that's it. I'm doing some damage control right here. Oh, no problem. So that's basically what it is. So the whole 12 leads are going to appear in one page. That's it. So you don't have to be moving 2 leads first, and then the second one, and then the third one, because it can come individually. It can go in 2s, in 3s, or the complete one. Nowadays, most of these machines, they just do the multi-channel, the whole EKG comes in one page.
Professor, can you take a break?
Sure, that's what I was checking. Yeah. When we come back, and it's a good timing because now we're going to start all these artifacts that we cannot cut it down and start. So don't get your 25 minutes, 30 minutes.